Hi, my name is Jessica Jackson. I'm doing a presentation on magnet therapy. Have you ever wondered about using magnets to help heal your wounds or help with your pain? So you might be wondering, well, what is magnet therapy exactly? So magnets, they work by relieving the pain. They send an electrical current that stimulates your nervous system and then blocks the nerve sensations in order to help the blood flow so that your blood cells can get more oxygen. Um, They have shown to affect cell permeability and improve oxygen delivery to the cells, like I said, leading to better absorption of nutrients, improved circulation, and then so your body is able to eliminate those waste products better. It can also reduce inflammation and pain and promote healing from wounds. So this is just a quick diagram showing you, if you're a visual learner, showing you how magnet therapy would work. As you can see on the wrist of the person, there is a little magnet bracelet that they are wearing. And then down on the bottom, you can see if they had no magnetic therapy, those blood cells are just kind of going all over the place, whereas if they are wearing the magnet, those blood cells are able to stay a little more uniformed and separate, which then allows them to get more oxygen so that way it can release more energy in your body. So magnet therapy goes back very, very far, as early as 2000 BC, where the Chinese actually used magnets for therapeutic uses in their medicine. And then later on, doctors in Europe reported that magnets could cure arthritis and gout, as well as patients who were poisoned or were having baldness due to older age. And then from 1734 to 1815 is when Franz Anton Mesmer, he found out that magnets can actually, the body responds better to those magnets, excuse me. Then in 1954, Linus Carl Pauling, he received the Nobel Prize for discovering the magnetic properties of hemoglobin. So iron is a good example of this. Iron is magnetic. So the hemoglobin reacts to the magnets in order to uniform those cells to bring oxygen to the body and help that blood flow a little bit better. And then in 1971, California did some experiments and it showed that magnet activates metabolic processes and promotes the formation of amino acid, which kind of helps aid in healing processes. Today, researchers are still experimenting with magnets and their effects on the body, so there is no conclusive research that states magnet therapy is very therapeutic or it doesn't cure anything. So they're still researching on how exactly what it does to the body and the benefits of it. So there are two types of magnet therapy. The first one is called static or permanent magnets. They're made from metal or alloys. They can be weak, moderate, or strong, but they're always on and they don't change. So for example, this would be like your bracelets that you wear. You can't change the intensity of that magnet. So they are used by placing the magnet near or on the body for pain relief or healing. Like I said, that's kind of like your bracelets that you would wear to help. They're often encased in a wrap, such as a wristband, and they vary in strength from 300 to 5,000 Gauss. So, but like I said, that they can't be, like the magnetic field can't be changed, so there's always just that one strength that's not going to vary on the static or permanent magnets. The second type of magnet is electromagnets. This is where it can change in intensity, and it's created with an electrical current that passes through a wire coil containing that magnetic material. So, for example, this could be like your TENS unit. The intensity can change and help promote those muscles to relax or the wound to heal. It can also help in bone healing as well as sleep. So what is magnet therapy used for exactly? Well, it can be used for arthritis pain, chronic pain, wound healing, or injuries to your muscles, tendons, ligaments. This would be really good for athletes. It can also help with insomnia and depression, as well as headaches and migraines. And then some people actually will use it for fibromyalgia or post-operative pain to get those blood cells moving a little bit better and get some more oxygen to your body. Now, magnet therapy is not safe for everybody. So those who have a pacemaker should not use magnet therapy because it can interfere with the pacemaker. Pregnant women should not use it. There's not enough evidence that it does not do harm to the fetus. So pregnant women should avoid it because, you don't want to harm your fetus. As well as those who use an insulin pump. Again, it's kind of like the pacemaker. It can interfere with the signals and then cause more detrimental effects. Patients who are undergoing procedures such as MRI or X-ray should not use a magnet therapy before those procedures. So if you are going to have those procedures, you want to make sure you remove your magnet. Like if you're wearing a bracelet or something, make sure you remove that because that can affect your test results, and it can also affect the machine that is conducting those procedures. Now, there are some side effects of magnet therapy. They are rare, but they can happen. Three of the most common is nausea, dizziness, and pain. Now, pain would more than likely be from that of like a TENS unit. If you have the magnetic electrical current too high, that can cause you more pain. So you're probably asking yourself at this point, like, does it even work? The studies on therapy that have been done, they don't have enough research to conclude exactly if it is more beneficial than detrimental. There are studies that show, it can help with the pain response and wound healing. But there's no clear proof that it can treat a condition. So it's definitely not going to cure, and they're kind of back and forth still on, does it actually help or not. So more research is needed as an alternative medicine therapy with the magnets. So some people who would benefit the most from trying out this magnet therapy would be people who are experiencing pain. It's going to increase that blood flow. So anybody who has like wounds, that could help aid in wound healing to get that blood flow to that wound and help promote the healing process. Athletes are a good example of people who could benefit from this because they typically get injured quite often with their muscles or tendons. Sometimes they'll get some wounds, so cramps, anything like that with their muscles. So they would definitely benefit from trying out magnet therapy. All right, so let's recap. So magnet therapy has been around since at least 2000 BC. It's been around for a very, very long time. We can use it to help with pain management, wound healing, and neuropathic pain like fibromyalgia. There are those two types of magnets used. That's the static that cannot change frequency or intensity, and then there's the electromagnets that can change intensity. It is contraindicated in patients who have the pacemaker, who are pregnant, and those who have an insulin pump, because that's going to interfere. Or as far as your pregnant patients, there's just not enough evidence that it does not cause harm to a fetus. So more research is needed to conclude the long-term benefits of magnet therapy. So I've got some critical thinking questions for you. Number one, if you were a researcher, what further studies would you conduct to prove magnet therapy is beneficial to patients who experience pain, have wounds, or have other symptoms? I know they're still trying to figure out, the long-term benefits. So what studies would you try to conduct to help facilitate that? And number two, how does magnet therapy help aid in the wound healing process? Give me some examples on like what happens and how it helps with wound healing. All right, thank you very much for listening, and I hope you have a good day.